to take this opportunity to welcome you to another edition of our CoreView pages. In this section, we're going to be talking a lot about bone stimulation. But before we get to bone stimulation, I'd like to focus you on a couple of key concepts. Why is it that CoreView actually matters? What we try to do at Ortho Evidence, and what CoreView hopes to bring to you, is better decision-making. And when we look at what can differentiate good practitioners from great practitioners, decision-making is the critical variable. In fact, sound clinical judgment is absolutely essential to ensure the highest standards of patient safety and care. We know this. There are no situations in which poor decisions perfectly executed result in good outcomes. In fact, it is a fundamental truth. Poor decisions perfectly executed invariably result in poor outcomes. So ultimately, when we think about evidence versus eminence, evidence always trumps eminence. And what we're thinking about this is evidence-based practice is critical because despite expertise, our expertise is often inherent in some of the biases we hold, and we have to be using data to ultimately drive better decision-making. It is through that Ortho Evidence ACE reports and ultimately ACE reports collated into reviews and reviews collated into what we're calling CoreView, or these pages, allows you to get a very consolidated, quick look at the body of evidence, the highest quality evidence that we can give you on a particular topic area. So once again, to remind you that we still always focus on the hierarchy of evidence, and within that evidence, we're talking about levels 1 through 5. Our goal is to bring you level 1 evidence. This is evidence from randomized controlled trials that we believe are high quality, or meta-analyses of randomized controlled trials that are high quality, to give you better insights about a particular topic area. So once again, in the bone stimulation area, we have great quality evidence. Based on survey data, it suggests that 1 out of 3 surgeons are aware and certainly have used bone stimulators of some sort over some period of time. We have 2 options at this point. We can focus on making sure that the surgeons who are using bone stimulators have good evidence to drive their decisions. But further, I think our view and the CoreView vision is that we want to do more. We believe the opportunity to provide better decision-making, better evidence is to the individuals who aren't using bone stimulation and help them understand whether or not it has a place in their practice. So ultimately, our goal with CoreView pages is to provide support to those who are using it to help them drive better decisions, and to possibly give individuals who aren't some insights into the evidence around bone stimulators in general.